Hello everyone, today we're going to be teaching about bones. I'm Perez-Erickson, and later on, Ignacio and Brandi Hager will be talking to you more about bone fractures. We're going to be giving you an overview of what a bone fracture is, the causes of bone fractures, fracture classification, the types of fractures, be it common and major, fracture reparation and major features of reparation, and finally, treatment and prevention. Fractures are defined by cracks or breaks in the bone and can be caused by any type of physical stress. Bone fractures are classified by the position of the bone ends after the fracture, the completeness of the break, whether it be complete or incomplete, the orientation of the bone on the long axis, and finally, whether or not the bone end penetrates the skin.
Next, I'm going to be talking about some of the types of bone fractures. First, we have displaced and non-displaced, where a non-displaced bone fracture is where both ends retain their normal position, and a displaced fracture is where the bones are out of their normal alignment. Then we have complete and incomplete. A complete fracture is where the bone is broken all the way through from one side to the other, and an incomplete is where the bone is not broken all the way through, only partially. And then we have linear and transverse. A linear fracture is where the break is parallel to the long axis of the bone, and then a transverse fracture is where the fracture is perpendicular to the long axis of the bone. A compound fracture, or open, is where the bone penetrates through the skin, where a simple fracture, in other words closed, is where the skin is not penetrated by the bone. Here are a few pictures on our slide. In the first picture, you can see non-displaced versus displaced fractures. In the displaced fracture on the right, it's clear that the bone is not in its normal alignment. Both are broken, but one is displaced and one is not. In the second picture down here, we have a simple fracture and a compound fracture. A compound fracture is where the bone goes through the skin, so there will be lots of bleeding and lots of extra complications with that. And then we have complete versus incomplete. In a complete fracture, the bone is completely broken all the way through the diameter of the bone, and in incomplete, it would not quite go all the way through the diameter of the bone. This is a linear fracture. It goes along the axis of the bone, whereas a transverse is the opposite, it's perpendicular to that. These are some more types of bone fractures. So we have epiphyseal fractures. This is where the fracture happens along an epiphyseal plate, which is a growth plate. This is a clean transverse fracture along the line, and it usually heals pretty well because it's at a growth plate where bone is being produced more rapidly. Next, we have a green stick fracture. This is an incomplete fracture where one side of the bone breaks and the other side has a bend in it. This usually happens in children because their bones are still in a period of growth. They're not fully developed, and the bones are able to bend a little bit more than they are in someone who's fully developed. Then next we have a comminuted fracture. This is basically a shattered bone. It would be in 3 or more pieces, and this happens a lot in elderly people because their bones are more fragile at that age. Next we have a spiral fracture. This is pretty much exactly what it sounds like. It's an oblique fracture where it's ragged at the ends, and the break is excessively twisted, and this happens a lot in sports. Next we have a depressed fracture. This often happens in the skull. This is where part of the skull gets pressed inward, and then we also have a compression fracture where a bone gets crushed, and this usually happens in more porous bones. So here are some more pictures to show examples of those fractures. This is an epiphyseal fracture. It happened at the growth plate. You can see it right here. Right here you have a compressed fracture. This happened in the skull. Blunt force trauma usually causes a fracture like this. This is a compression fracture. It happened in the vertebrae. And then this is a green stick fracture. There's a break on this side of the bone, whereas this side is just bent, not fully broken. Up here, you have a comminuted fracture. This is in more than 3 pieces. This is going to require a lot of extra help, more than some of these other breaks. And then this is a spiral fracture, and this diagram shows you a little bit of how a spiral fracture happens.
finally, we come to POTS fractures, which occur at the ankle and affect both bones of the leg, including the tibia and the fibula. Calls fractures, which is a break in the distal portion of the radius in the arm, and can occur when, say, you're reaching out to cushion a fall and your arm is cushioning you, and you break it. And finally, displaced fractures, which produce new and abnormal bone arrangements when the bone fractures. You can see here is a classic example of a POTS fracture, which is occurring in the fibula of the leg. You can see the break right here. Next, we have a Coles fracture, which you can see the radius of the arm has that fracture across the transverse plane. And finally, a displaced fracture, which you can see noticeably the femur, which is in the leg, is moved to the right and noticeably displaced. Okay, there are 4 major steps of fracture reparation. Hematoma formation, which is immediate after the fracture. Fibrocartilaginous callus formation, which occurs 1 week after the fracture. Bony callus formation, which occurs from 1 week to 3 months after the fracture. And finally, bone remodeling, which can occur and begin 3 months and go up to 3 years after the bone is broken. So reparation of fractured bones occurs through several stages, as noted previously, and it utilizes mechanisms already in place for bone remodeling. In this picture, you can note that blood vessels are torn within the fractures and release blood, which causes to produce a large fracture hematoma immediately after the bone is fractured. And this is gradually removed by macrophages and replaced by soft fibrocartilage, and it produces a mass of procallus tissue, which is rich in collagen and fibroblasts. If broken, the peristonium reestablishes continuity over this tissue. Okay, so this soft procallus is invaded by regrowing blood vessels and osteoblasts, which is preparing for the new bone formation. In the next few weeks, the fibrocartilage is gradually replaced by the trabecula of the primary bones and replaced by a hard callus throughout the original area of the fracture. Finally, the primary bone is then remodeled, and the compact bone is continuous and adjacent with the uninjured areas and fully functional.
Alright, so next we have treatment and prevention of the fractures. For treatment, the first thing you do whenever you first get a fracture would be first aid. So immobilize the injured area, use a splint or something you can use to stabilize the injured bone. You can control any external bleeding, like this would happen during open fractures. You gotta clean up the wound and everything. You can use rest, ice, compression, and elevation. And then, of course, call 911 if you haven't already. For treatment tools, you can use a splint, which stops the movement of the broken limb. You can use a brace to support the bone. A plaster cast to provide support and immobilize the limb. You can use traction, which is a less common option. It refers to the practice of slowly and gently pulling on the fractured area of the body using ropes, pulleys, and weights to help apply force to the tissue surrounding the damaged area to guide the body back into place. Specifically, skeletal traction involves placing a pin wire or screw into the fractured area by which the weights are attached to. And for compressed fractures, so something like a spinal injury, chiropractors and doctors will use spinal traction to relieve that compression. Also, surgical implements, if you need surgery, would be like intramedullary nails, internal fixators, metal plates, and screws. This would be more common in fractures that have multiple breaks, so like a comminuted fracture, an open fracture, or like a displaced fracture, we need to put them back together. And then you can also use pain relief like NSAIDs or some steroidal options. For surgical operations, for closed and simple fractures, 2 ends of the bone aligned and held in place. The limb is bandaged and wet plastered. For open and compound fractures, the wound is thoroughly cleaned in the OR because you want to prevent infection of the bone. They need to do this before setting the bone back into place. The long bones such as like the femur and the thigh, they're hard to keep aligned. Adults are often treated by internal nailing, and children may need traction for it. Probably 2 to 3 days before setting it in a bone or a cast. And for all surgeries, for the bones, if they need to be nailed into place, they need to be about 2/3 overlapped, or else if they're 1/3 or anything less, it's gonna probably break again. Now for prevention, this is the fracture triangle. The fracture triangle includes the fall, the force, and the fragility. The fall is included in the fracture triangle because the fall itself matters, like how did they fall, why did they fall, because I could slip on like a banana peel and land on my elbow and then fracture that part of my elbow, or I could trip down the stairs and tumble down and fracture multiple parts of my body like an elderly person would. The force of the fall, that is important because different forces of impact can cause different breaks. So say I jumped off a 2-story building, landed on my leg, had an open fracture on my leg, but then I jumped from this table right here, I wouldn't probably have any bone break at all. The fragility, that depends on how fragile the bone is. That's important because most elderly people and young children who are still developing, they'll have more fragile bones. Also, each bone has a different fragility level to it. Like the femur would be a little stronger than, let's say, your radius or your fingers. But yeah, this is a fracture triangle. Any questions, comments, and concerns?
Stop. X-rays are the most common way to identify a break in a bone. X-rays have been used since 1895, when they were discovered by accident by Wilhelm Conrad Röntgen, a German professor. Radiation, the technique employed, penetrates the soft tissue but not the bone, producing an image through shadows. This is in comparison to an MRI, which can penetrate both bone and soft tissue to create a 3D image of the fractured or damaged area. MRIs are employed when there is internal bleeding, or suspicion of such, caused by bone fragments like that of a broken rib. Bone fragments can also penetrate internal organs, like that of the spleen. The penetration of the spleen would cause massive internal bleeding, which would then be cause for the removal of the spleen. X-rays were initially thought to be harmless until 1904, when Thomas Edison's assistant, Clarence Daly, died due to prolonged X-ray exposure, which caused skin cancer. After his death, health concerns were raised, and now lead clothing and protection is used by both technicians and patients to minimize the X-ray exposure.
Wow.
Under X-rays, there are 2 main types. We have soft X-rays and hard X-rays. The main focus of this PowerPoint and this presentation is the hard X-rays, because due to their higher penetrative ability, they have the upper hand in terms of medical usage and functionality. For bone fractures, you can use them because they penetrate through the soft tissue, like we mentioned. Hard X-rays have wavelengths of about 100 picometers, and then there are soft X-rays. These are more commonly used to study microscale biological structures. Soft X-rays have short wavelengths of about 10 nanometers, much shorter than that of long wavelengths, and due to these wavelengths, they produce X-rays that give scientists and researchers the ability to see extremely small structures, unlike the hard X-rays, which have long wavelengths. These electromagnetic waves occupy the same region of the EM spectrum as gamma rays. The only difference between them is their source. X-rays are produced by accelerating electrons, whereas gamma rays are produced by atomic nuclei in one of 4 nuclear reactions.
To conclude our PowerPoint, here's some fracture fun facts. The 2 most common cast colors are neon green and pink. Now how's that for fashion? The 5 most common broken bones are the tibia, ulna, fibula, radius, and the humerus. But that isn't so funny. The most painful break would be the femur bone, probably due to its thickness and high vascularity. The top 5 causes of fractures are all sports, snowboarding, monkey bars, trampolines, and scooters. So stop monkeying around. In terms of gender, males are 59% likely to break a bone compared to 41% in females, probably because males are more high risk takers and they're stupid.